Friends, in my talk now, let me explain the role of cholesterol, the causes of high cholesterol, its symptoms, treatment, and prevention. And as a layman, I will explain all this in layman's language only. Cholesterol is an oil based substance, it's waxy and fat like in appearance. It does not mix with the blood because blood is water based and it travels around the body in lipoproteins. Cholesterol is both good and bad. At normal levels, it is an essential substance for the body. However, if concentrations in the blood get too high, it becomes a silent danger that puts people at risk of heart attack. So, cholesterol is present in every cell of the body and it has got very many important natural functions to do. When it comes to the question of digesting the foods, producing the hormones, generating the vitamin D, contributing to the structure of cell walls, making up the digestive bile acids in the intestine. So it plays a very, very important role. The body produces this, but people also consume it in food additionally. See, there are two types of cholesterol, the LDL and the HDL. So LDL means the low density lipoprotein or it is a bad cholesterol and high density lipoprotein HDL is a good cholesterol. So in others the total cholesterol levels less than 200 milligrams per deciliter mg per dl. They are considered healthy. 200 to 240 mg per dl is borderline high and 240 and above it is considered as high. That is the total cholesterol. And LDL, that is the low density cholesterol, its level should be less than 100 mg per dl. 100 to 130 LDL is also acceptable for people with no other health problems. But it may be a concern for anyone with heart disease or heart disease risk factor. And 130 to 160 LDL, it is borderline high, 160 to 190 is high, and 190 mg per dl or higher LDL, it is considered very high. And HDL levels it should be kept higher. The optimal reading for HDL levels it is of 60 mg per dl or higher. So a reading of less than 40 mg per dl can be a major risk factor for the heart disease, and a reading from 40 to 60 HDL it is borderline low. So reasons for high cholesterol include the family history, lifestyle choices, diet, etc. Having high cholesterol does not usually produce any symptoms. And cholesterol levels, they are very high. A doctor may prescribe a lipid lowering drugs, tablets, medicines. And eating fresh food and avoiding animal fats and the processed items, it can also help people to control the cholesterol levels. It's a natural method. The high cholesterol is a significant risk factor for the coronary heart disease and a cause for a heart attack. A buildup of cholesterol, it's part of the process that narrows the arteries called the arteriosclerosis. It causes a restriction of blood flow, reducing the intake of fat in the diet. It helps to manage the cholesterol levels. In particular, it is helpful to limit the foods that contain the cholesterol. And this is present in animal foods, meat, cheese, so these we should avoid. And the excess weight or obesity, it can also lead to higher blood LDL levels. The genetic factors can also contribute to the high cholesterol. People with the inherited condition, they have very high LDL levels usually. So the other conditions that can lead to high cholesterol levels include the diabetes, the liver or kidney disease, the polycystic ovary syndrome, and even the pregnancy and other conditions that increase the levels of female hormones. The underactive thyroid gland can be one of the reasons. High cholesterol symptoms, of course, as I said, a person with high cholesterol levels often has no signs or symptoms, but only the routine screening and regular blood tests can help detect the high levels. So a person who does not undergo testing may have a heart attack without warning. So because they did not know that they had high cholesterol levels. So regular tests can help to reduce this risk. The cholesterol lowering foods that actively decrease the cholesterol levels, they are oats, barley, whole grains, beans, the eggplant, even the nuts, vegetable oils, and the fruits like apples, grapes, strawberries, and citrus. And even the soya and the soya-based foods, foods rich in fiber. So these are very, very important in lowering the cholesterol. And adding these to a balanced diet can also help keep the cholesterol in check. So, preventing high cholesterol, people who wish to reduce their cholesterol levels or maintain a suitable level, they can definitely make four major lifestyle decisions. That is number one, eat a healthy diet. Two, regular exercise. Three, avoid smoking. Four, achieve and maintain a healthy weight. So these actions will definitely reduce the risk of coronary heart disease and heart attack. So there are a number of ways to treat the high cholesterol. So for a person with high cholesterol levels, the drug treatment will depend on their cholesterol levels and other risk factors. So recommendations usually start with the diet and exercise only. But people with a higher risk of a heart attack may need to use the cholesterol lowering drugs available on prescription of the doctors. So cholesterol levels play a major part in an individual's risk of having the heart attack even within the next 10 years. And because the risk depends on age, sex, cholesterol levels, smoking status, the BP, etc., etc. So we have to take precautionary measures and try to reduce the cholesterol levels to, the normal levels required in the human body. So thank you very much. Thank you very much, friends.